First thing I'm going to do is verify the physician's orders and review the client's history for any conditions that would impair catheterization. I'm going to assess pertinent lab results and check for allergies. I'm then going to assess the client's weight, age, level of consciousness, ability to cooperate, and mobility of their lower extremities. If needed, I'm going to delegate assistance with positioning and gather all of our necessary equipment, such as our washcloth and our cath tray. I'm going to take the supplies into the room and provide patient privacy. I'm going to introduce myself and I'm going to perform hand hygiene. I'm going to identify the client using 2 patient identifiers, such as their name and date of birth. I'm going to explain the procedure I'm doing today. I'm going to apply clean gloves and position the patient. For females, I would put them on their back with their knees flexed in the dorsal recumbent position, and for males, like my patient today, I have them lying supine with their legs extended and their thighs slightly abducted. Next, I'm going to drape the patient so that only the genitalia is exposed. I'm going to clean the area using soap and water. I'm going to get another washcloth to rinse, and then I'm going to let that dry. I'm going to remove my gloves and perform hand hygiene. And next, I'm going to place the catheterization kit on a clean surface and open the outer wrapper using sterile technique. I'm going to apply sterile gloves and I'm going to maintain sterility throughout the entire procedure. Alrighty, I'm going to discard that. Now I'm going to apply a sterile drape according to the gender. Again, this is a male, and I'm going to make sure I maintain sterility. I'm now going to assess the integrity of my equipment, so I'm going to remove this tray. I got my saline, my alcohol swabs, my lubricant, and my catheter and bag. Everything seems to be intact. Now I'm going to connect the saline to the catheter, just so I have that done, ready to go. I'm going to put my lubricant in the tray. Remove my alcohol swabs, then put the lubricant in the tray. Then I'm going to remove my alcohol swabs and also put them in the tray. Now I'm going to clean the urethral meatus with my alcohol swabs, and I'm going to do that in a circular motion. Okay. Now I'm going to lubricate the catheter. Rolling it in the lubrication jelly. Now I'm going to insert this into the male patient. I'm going to grab the shaft of the penis with my non-dominant hand and insert 7 to 9 inches. Before insertion and during insertion, I'm going to tell the patient to be taking in deep breaths. Okay, now that the catheter is fully inserted, I'm going to continue to hold the I'm going to hold the catheter in place with my non-dominant hand, and I'm going to fill the balloon with my pre-filled syringe, using my pre-filled syringe, according to hospital procedures. Okay, I have now filled the balloon. So, I've now filled the balloon. I'm still holding on, and then I'm going to pull the catheter very slightly until I feel resistance, and then I'm going to let that I'm going to let that go, and I'm going to remove my gloves. Discard of those. Perform hand hygiene, and I'm going to put on some clean gloves. Sorry, my hands are kind of sticky. Yeah, my hands are kind of sticky. Okay, and I'm going to remove the sterile drape. Discard that. And then I'm going to secure the catheter to the inner thigh using a hypoallergenic tape. I'm going to make sure the drainage bag would be positioned below the bladder to allow for free gravity flow. And I'm going to hook it onto the bed frame, not the side rails. I'm going to get a new washcloth and cleanse and dry the perineal area. Being careful not to mess with the catheter too much. And then again, let that dry. And then I'm going to follow completion protocol and re-drape the patient. I'm now going to remove all of my equipment. Place in an appropriate charge receptacle. I'm going to remove my gloves. Perform hand hygiene. I'm going to observe the urine in the catheter bag for amount, color, and clarity. And then lastly, I'm going to help my client into a comfortable position, raise the side rails ×2, and lower the bed into its lowest position. Place the call light next to them, let them know if they need anything to call me. Let them know if they need anything, and then I'm going to document the procedure and its outcomes.